Good morning, everyone. My name's Stephen Monroy, and I'm a board member of Forward Latino. It's my honor today to introduce Dr. Sydney Timmer-Murillo. Dr. Timmer-Murillo is a psychologist and fellow in trauma and health psychology at the Medical College of Wisconsin in the Trauma and Acute Care Surgery Division. Sydney provides mental health treatment to those who experience traumatic injury with a particular focus on firearm violence. Her translational and applied research examines factors that contribute to quality of life after trauma, promoting health equity and early access to treatment, particularly for individuals who experience interpersonal violence. For her expertise, she has published articles on her research in numerous medical journals. So we'll have Sydney come to the stage. Thank you.
Good morning. First, I just want to say how honored I am to be here today in front of you all in a group. I want to thank Daryl so much for the opportunity to speak and the 80% Coalition, and especially want to thank you for allowing mental health to be a part of this conversation. It's such an important component to the issue of gun violence, and so, like I said, it's really an honor to be here. Like we said, I'm a psychologist by training, and I do research in mental health and trauma and the effect of trauma, but I also work with and treat and provide therapy for survivors of trauma and predominantly gun violence survivors. And so I think it was so appropriate what was said already is, it is personal. Sitting with those individuals who've experienced gun violence and are just trying to move forward with their life and yet feeling the weight and the burden of being shot, it's impossible to be numb. And so any way that we can advocate and elevate what this concern is and dealing with the effects of violence, I think is so vital. And so for today, I do want to focus in on just what is the experience for gun violence survivors from a mental health perspective and better understand what are the risk factors, what are those things that increase your chances of going on to struggle with a mental health issue after you've experienced gun violence. And then from there, try to apply it in how can we provide better care? How can we support individuals who have experienced gun violence? So to start, we all know that more and more people are experiencing gun violence. It's increasing, and yet while we often focus in on the deaths related to gun violence, that's what we hear most often in the media. The fact is more and more people are living with the experience of gun violence, with the injuries of gun violence. And we really don't know that much about the experience of gun violence survivors when we think about it from the research perspective, because that's been kind of underdone and undersupported. But what we know broadly is that trauma disparities exist in our community. There is so much disparity in who is more likely to experience trauma, who's more likely to experience injury, but also who's more likely to have negative outcomes after trauma. And the same is true for gun violence. There's racial disparities, socioeconomic disparities in who is more likely to experience gun violence, but also who's more likely to struggle afterward. And that's because of these structural, systemic experiences of discrimination that really prohibit and really reduce an individual's access to resources in order to move forward and try to grow after gun violence. And so when we think about mental health, we can't assume that everybody's experience is the same. We can't assume that everybody's access to resources is the same, because it's not. So what does mental health look like after gun violence? As many of you know, I think we often just think about what that shooting looked like or what that act of violence looked like, but for a gun violence survivor, it doesn't end there. The trauma is so much bigger than that, and that they worry that whole time that they're waiting for emergency medical services to arrive. They are in fear that whole ride to the hospital. They wonder how severe their injuries are. They wonder if they're going to live. And they carry this burden of trauma that whole length of that trip to the hospital. But then it doesn't end there. The hospitalization for a gun violence survivor can be incredibly traumatic as well, as you lose autonomy. You're confined to a hospital where you can't get access to your social support, your loved ones. And so the experience is much more drawn out than what we always or necessarily think about. And this is important when we think about mental health, because the longer it is that you're experiencing trauma, the more traumas that you experience, that really can have a negative impact on your mental health. On top of that, when we think about gun violence, there's also this really critical aspect of threat to your safety. You were just shot, and you don't know if you're going to be safe when you leave the hospital. And so this idea that you have to go home and recover when you don't know what the circumstances, when you don't know if you're truly safe, can really heighten that sense of threat, and again, heighten that chance that you might experience negative mental health outcomes. Broadly, when we look at all traumas and all traumatic injuries, so that includes things like car crashes, motorcycle accidents, falls, the risk of developing a mental health disorder is about 20 to 40% of individuals getting either PTSD, post-traumatic stress disorder, or a major depressive episode. But again, the reality is this is likely an underestimate for gun violence survivors, because there's so much more context, there's so much more to the picture that's going to increase their likelihood of developing a mental health concern. So what are those concerns? As many of you know, post-traumatic stress disorder is an anxiety-based disorder that comes from trauma. And this looks like having this heightened sense of fear, almost like an alarm system in your brain that's trying to detect if you're still at threat, if your safety is still at risk. And because of that, we are hypervigilant to our surroundings. We're watching that door, seeing if people are coming in. We're jumping when we hear noises because we think everything is a threat now that we've experienced trauma. It also includes those like classic symptoms that you might have heard about, like nightmares, the flashbacks, reliving that trauma over and over and over again. And because we have all of these negative experiences after trauma, we want to avoid. And that is really a hallmark symptom of PTSD, that you're trying everything in your power to have some control again, and we're choosing to avoid life, avoid situations that might put us in harm's way again. But that only serves to perpetuate the problem, because then we're not going back out into our communities, we're not seeing loved ones, and it just kind of repeats the cycle of struggle. After that, I think we often talk about PTSD as the primary mental health concern after gun violence, but I think depression is an important one for us to reflect on well for gun violence survivors, because so often with gun violence, it impacts our sense of self, and it impacts your sense of worth. And if you have traumatic injuries from gun violence, you might not be able to support your family. You might not be able to work in the same way. And that can really impact our self-esteem and increase your chances of having a low mood, not wanting to do your typical activities and withdraw and isolate. And when we think about gun violence, we also have to think about the reciprocal nature of mental health and physical health. So often we think just about the physical injuries when we work in a hospital setting. We're just trying to prevent complications, get people out of the hospital, prevent readmissions to the hospital. But there's been this increasing awareness that we can't just focus on somebody's physical injuries when they've experienced gun violence, because so much goes into somebody's quality of life beyond just physical injuries. And that includes your mental health. That includes how an individual perceives how they are doing. And so there's this constant feedback loop between your physical health and your mental health. And so it's vital for us to recognize that mental health needs to be an important aspect of our care for gun violence survivors if we want them to fully recover, if we want them to be able to get back out into their communities in a healthy way. And so from our research, like I mentioned, we really don't know much about the exact rates of mental health concerns after gun violence. And we just published this on Tuesday, these new results looking at gun violence survivors from here in Milwaukee. And what we found is that right after experiencing gun violence, we see people reporting greater symptoms of PTSD, endorsing that higher experience of flashbacks, nightmares, fear for their safety. And yet, when we have them come back 6 months later, their symptoms don't go down, which is what we actually see with most trauma survivors, is that eventually their symptoms can kind of go down on their own. What we see for gun violence survivors is their symptoms are increasing just within those 6 months after being shot. And not only do they increase, but they then go so high that they reach that level of receiving a diagnosis for PTSD. But like I alluded to, it goes beyond just PTSD. Our gun violence survivors are endorsing a spectrum of concerns. They're endorsing higher levels of anxiety, which is, again, increasing with time from after being shot to 6 months later. They're endorsing more depression and more just general levels of stress. Like, we ask them, just how are you feeling? How do you feel like you're navigating your day-to-day? And they're reporting more stress in their day-to-day, even outside of just experiencing PTSD or depression or anxiety. And then we also look at that health, because we know that there is this back and forth relationship between your mental health and your physical health. And again, we see that gun violence survivors are reporting feeling physically poor, feeling like they can't do their day-to-day activities, that they're limited. And this is even after 6 months where their physical injuries should largely be healed. They still feel lower health than the general population. And we've also looked at what is firearm violence survivors' experience in comparison to other traumatic injuries. And this is really to highlight that we need to recognize that gun violence survivors need their own approach to care. They need additional support that's different from other trauma survivors. And again, we see that when you look at firearm violence survivors compared to car crash survivors, again, our firearm violence survivors are reporting more anxiety, they're reporting more depression and higher levels of general stress when you look at them in comparison to car crash survivors. And this is their self-reported experience. And so we need to highlight that they are saying, we need more help. We are experiencing these things, and we need to be stepping in and supporting their mental health journey in recovery. And on top of this, one thing that I don't have on there is that they are also reporting significantly elevated PTSD symptoms compared to car crash survivors. And so we see these differences in outcomes, and we see the elevated risk that people are experiencing negative mental health after gun violence. So what increases this risk? I think the most important thing, or one of the most important things to recognize, is the context of recovery. Social determinants of health are the factors, the social and the environmental factors that have a fundamental impact on our physical health and our mental health. And that looks like economic stability. It looks like your community environment. How safe is your community? How much community violence is there in your neighborhood? Access to adequate health care and resources, or even mental health care. All of these external factors are going to have a fundamental impact on somebody's ability to recover from trauma. And if they don't have the resources they need, if they live in an environment where they don't feel safe, that is absolutely going to impact whether or not they go on to then experience PTSD or depression or anxiety. And so in our approach to care, we argue that you have to consider the context. You have to think about what a person experienced even before they were shot. We need to understand how much trauma did they experience even before gun violence? Did they experience elevated threats to their safety over time? And then now they're coming in with a gunshot wound and have even more stress kind of piled onto them. And we also need to think about not just what they've experienced, but what they've witnessed. When I work with gun violence survivors, I can't count the number of times where they've talked about how they'll open their window at their home and hear shots regularly. And when we think about that, it's just astounding how if you're hearing shots regularly and you just experienced a gunshot wound, your threat system is only going to be more activated. It's only going to be more heightened, and it's going to be harder for you to feel like you can find a path to recovery if you think you can step outside your door and then be shot again, which is the reality for so many individuals living with the effects of gun violence. The other thing I want to call attention to is the experience of discrimination and the experience of that as a form of trauma as well. We've seen in our work that the more experiences of racial discrimination that you've had even before you were injured can shape your recovery as well. And again, it speaks to that idea of the alarm system. How much burden have you had of racial discrimination or previous forms of trauma, and now you're trying to recover from trauma of gun violence? And an important stat that we've found in our work is that we'll bring somebody in right after their injury, and then we'll have them come back 6 months later, and over 50% of our trauma survivors reported experiencing another trauma. Again, just within 6 months, they've already experienced another trauma. And when you think of that and how early that is in your recovery, and us not even looking at 2 years out, 5 years out, it was already in 6 months more than half of our survivors experienced this. We have to think about how can we better care for these individuals who are repeatedly, constantly experiencing trauma exposure and are just trying to get back on their feet and try to move forward in their life and make meaning in their life. And so how do we better care and better support our gun violence survivors? How do we call more attention to mental health in their receipt of care? And so our work, we try to say from the very moment they get to the hospital and on, we need to be providing more thoughtful, more holistic, more comprehensive care for these individuals. We need to include trauma-informed care in our provision and our giving of care in the hospital setting. And that looks like trying to do our part to reduce the likelihood of re-traumatization, knowing that the hospital stay can be incredibly traumatizing for individuals. It's also reducing the barriers that exist in our communities of accessing mental health treatment. And the best way we can do that is by providing mental health treatment in the hospital right from the get-go if they need it, giving them that support. And that not only gives them early access to treatment, but it also reduces the barriers, the stigma of mental health treatment, because so often that can be a big piece of the burden, is not wanting to pull on those resources, not knowing that you can pull on those resources and access the resources. And then we need to think about long-term care. And so recognizing that the hospital is maybe that perfect time point where we can start providing support, but that it doesn't end there, that we need to give our patients long-term support because we know those social factors exist, because we know the environmental factors exist when they leave the hospital, and providing them support. And so the Medical College and Freighter and 414 Life, the CIC, the Comprehensive Injury Center, there are so many key pieces of what we do that help support our gun violence survivors. And for instance, we recognize those systemic factors, those social factors are critical. And so after they leave the hospital, we bring them back within a week and get them access to providers that can help address those social determinants of health. We have them meet with another mental health provider again to give them that touch point, that support. But then they get to meet with social work. They get to meet with a physical therapist and ensure that all of their needs are met, because we can't treat gun violence survivors holistically if we don't provide them all of the resources that they need to recover. And so I feel like I keep saying the same thing over and over again, is what I'm trying to get at is we need to provide more comprehensive care, and we need to provide interventions that go from the community all the way into long-term care for our gun violence survivors, because the mental health risks are real and they're not talked about enough, and yet the impact that mental health can have on somebody's life, somebody's quality of life, is profound. And so thank you all so much for your time. Thank you. Up here, I just want to recognize our funders, our collaborators, because it truly takes a village, it truly takes a large team to do the work that we do. And my contact info is up there if you have any questions. Thank you again.